A quick glance tonight at COVID-19 cases in Alabama. More than 244,000 confirmed cases since March. 49,000 of them reported within the last 2 weeks. But more and more people are learning their status. More than 1.7 million people have been tested. Reported recoveries now stand at 177,000. Alabama received 40,000 doses of the coronavirus vaccine today. UAB could get its 10,000 tomorrow.
The general public will have to wait a few months before their vaccine is available. For now, half go to select EMSs, doctors' offices, and general hospital staff, while the rest are designated for frontline hospital workers. Doctors with UAB warn we still have a long fight ahead.
The vaccine is not going to stop the surge that we're experiencing now. It won't be available in quantities sufficient enough for us to stop this surge right now.
Cullman Regional Medical Center received its first shipment of vaccines. The first round will be given to employees tomorrow. The vaccines have been on ice and have a short time in which they must be used after being defrosted. As the vaccine arrives here, it's also making its way to hospitals across the country.
Yeah, here's a look at some vaccine doses arriving at a hospital in Boston. You can see on the box it says, "Do not move." But a worker carts it from an office into the hospital hallway. And in Kentucky, we see some people being administered the shot as part of a demonstration. The governor calls the vaccine's development nothing short of a miracle. How about Florida? Several boxes filled with doses arrived inside a FedEx truck. The worker unloaded the delivery to the sights and sounds of cheers and claps. You can't hear them there, but believe me.
And living in rural Alabama comes with a unique set of challenges. During the COVID-19 pandemic, those challenges pose severe consequences. WVTM 13's Bria Douglas shows us how healthcare workers combat the virus in the state's most isolated areas.
10 counties in Alabama have a 45% positive COVID-19 rate. 7 of those counties are in rural parts of the state.
Those kinds of places are experiencing a faster, more accelerated pace of disease than some of the places in central Alabama.
Even more concerning for UAB medical professionals like Dr. William Curry are the challenges these areas face getting tested and soon to be vaccinated. One of the biggest hurdles is access to hospitals or clinics and the amount of time it takes to get results back.
We have a number of counties now with no hospital at all. And most are underserved in terms of primary care.
Which is why UAB launched rural mobile testing around the state. But even if every rural county had easy access to COVID-19 testing, Dr. Curry says some people still won't take it.
More people are telling us, look, if I'm positive and I can't work, I don't get any income.
The next challenge ahead for healthcare workers is vaccinating all 4.5 million Alabamians, especially convincing those who have already said they aren't getting it.
There are a lot of people, and trying to vaccinate at least 70 or 80% of that large number is a very daunting task, and we need to do it quickly.
UAB will receive about 11,000 doses of the Pfizer vaccine, which the hospital expects to get sometime this week. Bria Douglas, WVTM 13.